Thank you for subscribing to this channel. This is a Reading Part C practice video.
The correct option is indeed A, are caused by surgery. Here's why this is the correct option and why the other options are incorrect. A, are caused by surgery. The guidelines clearly state that incisional hernias occur postoperatively, meaning they develop after abdominal surgery. These hernias pass through incisions made during surgery, and they occur when the closure of abdominal tissues fails to heal properly. So, it is accurate to say that incisional hernias are caused by surgery, making option A the correct choice. B. Form when patients cut themselves. This statement is not supported by the guidelines. Incisional hernias are not formed when patients cut themselves. They form due to surgical incisions not healing properly. Option B is incorrect. C. Occur more frequently than other hernias. The guidelines do not provide information about the relative frequency of incisional hernias compared to other types of hernias. Therefore, it cannot be concluded from the provided information that incisional hernias occur more frequently than other hernias. Option C is also incorrect. In summary, the guidelines clearly state that incisional hernias are caused by surgery, making option A the correct and supported choice.
Let's look at the next question.
The correct option is indeed C, who have a particular genetic makeup. Here's why this is the correct option and why the other options are incorrect. C, who have a particular genetic makeup. The passage clearly states that individuals who have 2 or more functional copies of the CYP2D6 gene are considered ultra-rapid metabolizers of codeine. These individuals can metabolize codeine to morphine more rapidly and completely, which can lead to life-threatening or fatal respiratory depression or overdose symptoms even at normal doses. This genetic makeup affects how codeine is processed in the body and can result in adverse effects. Therefore, option C is the correct choice. A, who suffer from opioid addiction. The passage does not mention anything about individuals suffering from opioid addiction in relation to codeine side effects. It primarily discusses the genetic makeup of individuals and how it affects the metabolism of codeine. Option A is not supported by the provided information. B, who take it together with morphine. The passage mentions that codeine's analgesic effect is due to its conversion to morphine, but it does not discuss side effects related to taking codeine together with morphine. Therefore, option B is not directly supported by the information provided in the passage. In summary, the passage highlights the importance of considering an individual's genetic makeup, specifically, the presence of functional copies of the CYP2D6 gene, in relation to codeine side effects, making option C the correct choice.
Let's look at the next question.
The correct option is indeed B, prevent a scab from forming. Here's why this option is correct and why the other options are incorrect. B, prevent a scab from forming. In the provided guidelines, it is mentioned that immediate action should be taken when there is an exposure to potentially infected body fluids or blood through open wounds. Specifically, it states that wounds should be encouraged to bleed and prevented from beginning to clot before the area has been cleaned. This is an important step in preventing infection, especially in cases of exposure to blood-borne viral illnesses. Preventing a scab from forming can help ensure that any potential contaminants are washed away, reducing the risk of infection. So, option B is correct. A, avoid contact with other staff. While it's generally a good practice to avoid contact with other staff when there is a risk of infection, the provided guidelines focus more on immediate actions to take when there's an exposure to potentially infected body fluids or blood through open wounds. Option A is not specifically mentioned in the guidelines, and the guidelines emphasize specific actions like cleaning and preventing clotting. C. Disinfect and cover the wound. While disinfecting and covering the wound is a reasonable response to an open wound exposed to potentially infected body fluids, the guidelines do not explicitly mention disinfection or covering the wound as the immediate action to take. Instead, they emphasize washing the injury or exposed region with water and preventing clotting. Option C is not directly supported by the provided guidelines. In summary, the guidelines recommend preventing a scab from forming on an open wound exposed to potentially infected body fluids or blood, making option B the correct choice based on the information provided.
Let's look at the next question.
The correct option is indeed C. They must be destroyed after use. Here's why this option is correct and why the other options are incorrect. C. They must be destroyed after use. The training manual clearly states that employees should dispose of any identifiable information in specially marked bins for later incineration. This means that confidential documents should be destroyed after they have served their purpose to ensure patient privacy and prevent unauthorized access. So, option C is the correct choice and aligns with the guidelines for handling confidential documents. A. They must not be consulted in an open area. While the training manual emphasizes the importance of avoiding discussions of patient details in public settings like hallways or elevators, it doesn't explicitly state that confidential documents must not be consulted in open areas. Option A is not directly supported by the provided information. B. They must only be shared via work email. The training manual does mention the importance of using secure forms of transmission when sending patient information to other providers, such as using hospital email and fax rather than unprotected methods like texting or personal email. However, this is related to communication methods, not the handling of confidential documents themselves. Option B is not a direct point made about confidential documents in the manual. In summary, the training manual emphasizes the need to destroy confidential documents after use, making option C the correct choice based on the information provided.